Representative Beutler, since you did not hold a public town hall during your district days, we've compiled a video of just a few of many questions your constituents have. We ask you hold a town hall when you return in April.
Hello, Congresswoman Herrera Beutler. I have a few questions for you. The first is, will you ensure that children can stay on their parents' health insurance until age 26, as in the ACA? Secondly, I want to know whether or not you are going to ensure that the pre-existing conditions clause that is in the ACA will be maintained. That's very important to your constituents. The third question I have is, will you hold a town hall when you return for your recess in April? There are many of us here who would like to talk with you in person. Thank you very much.
Congresswoman, my name is Sandy Montag. I worked for 20 years in the Multnomah County Health Department as a nurse practitioner caring for low-income women, and I find that your position for defunding Planned Parenthood is very, very troubling. Planned Parenthood is a safety net and is still needed. Even though we had the ACA, those clinics were full. Repealing ACA and defunding Planned Parenthood will decrease women's access to reproductive health care, and your proposal for community health clinics will be unable to meet that need. We're going to see a result of that will be unintended pregnancies, increased demand for abortion, increased sexually transmitted diseases, and decreased cervical and breast cancer detection. The thing that is most troubling to me, however, is the restriction on access that affects those with the fewest resources, adding to racial and economic inequities. So my question for you is, how can you guarantee that the money you propose to give to community health clinics will go for reproductive health care? And how will you ensure that there is sufficient funding to meet the needs of these very vulnerable women?
Hello, my name is Elsie Thompson, and I'm a retired special education teacher. I have 25 years of experience in public education, and I wanted to take a moment to express my concerns to you about House Bill 610. I feel like it will have a detrimental effect on public education, and I am especially worried about children with special education needs. I feel like it's going to be very difficult for parents to find suitable programming for their children, especially in rural areas. And I do also believe that the overall affordability of special programs will become an issue, because I do understand, I've done some research, that vouchers only pay a portion of the total cost. I am also concerned about the second part of House Bill 610, which talks about removing some nutritional standards for school lunches and breakfast, and I frankly just don't understand that portion of the bill, because I think that schools needs to be responsible for making sure that students have good nutritional food available to them. I would love to have an opportunity to talk to you in person, and I look forward to an opportunity for meeting you at a town hall in the near future. Thank you very much for your time today.
Hi, Rick McClure, Trout Lake. This is an aerial photograph of a train derailment that happened in the Columbia River Gorge a few years back. When it happened, the Environmental Protection Agency dispatched an emergency team from Seattle to help manage the incident and prevent contamination of the Columbia River. For this reason, we need the EPA. So please oppose any efforts on the part of your colleagues in Congress to abolish the EPA or weaken its authority.
I have a question about the environment, and climate change is really important to me, and I just want to know how you feel about it. If you're on board with the fact that there is such a thing as climate change, and you're willing to work with other countries in helping us be more environmentally friendly and responsible.
Hi, I'm Mary Kay McNallen, Clickitat County resident and registered voter for the last 38 years. Hi, I wanted to know, why is Steve Bannon allowed to have a seat on the National Security Council? Has he ever been totally vetted to be there? I feel personally that he should not be in the room. He has many personal views that are counterproductive to the United States of America, our democracy, and our government. In his words, he would like to tear it all down. Do you plan to have any oversight over him or any control over him and remove him from the NSC? He does not need to be on the National Security Council.
Hi, I'm Carlene Swartzstrauber, and I live in White Salmon, Washington. And I have a question for you. Will you defend our First Amendment rights by making a statement against our president's attack on the press and misrepresentation of facts and data? I am a physician. Before the ACA, poor patients and those without insurance would go to the emergency room for their care. After the ACA, these people became my patients, and I watched their health improve and the use of expensive ER visits go down. My question is, are you going to send my patients back to the expensive emergency rooms for their care?
Hello, I am John Fowler, a pulmonologist in Vancouver, Washington. I have two questions for Representative Herrera Beutler. Firstly, does she understand the difference between providing access and coverage for patients? Access is the door that is opened as long as you can afford exorbitant healthcare insurance costs out of pocket. Coverage being us stepping up as a community to ensure that our patients have adequate healthcare insurance. Secondly, I would like to ask if she will go to bat for us and ensure that every one of us gets the same kind of lifelong gold-plated insurance healthcare coverage that she and her family have enjoyed since the minute she set foot in the House of Representatives. Thank you.
Ms. Herrera Beutler, you say the ACA was supposed to reform our healthcare system, but much of the reform consisted of moving hundreds of thousands of middle-income Americans from employer-based plans to the taxpayer-funded Medicaid safety net meant for low-income folks. Washington State is using Medicaid expansion to cover an additional 600,000 people using Apple Health insurance plans. How many people would your plan allow into Medicaid in Washington State? And how many people would be left having to find coverage elsewhere? Where is your plan's income cutoff for Medicaid for individuals and families? At what income does middle income start? Thank you, and we look forward to your answer.
My name is Jolene Bevel from Vancouver, Washington. As a retired public school teacher who cares deeply about all students, I have one question for you. Do you plan to vote no on House Bill 610, which would eliminate the Elementary and Secondary Schools Act? Thank you.
Pat Arnold from Trout Lake, Washington. Ethics staff from past GOP and Democratic administrations say that Mr. Trump should put his assets in a blind trust or divest them completely. In December 1974, Antonin Scalia, then an employee in the Ford Justice Department, recommended the president comply with the conflict of interest standards. Scalia wrote, "Failure to observe these standards will furnish a simple basis for damaging criticism, whether or not they technically apply." Do you think that Mr. Trump should put his assets in a blind trust? Will you support legislative efforts to require him to do so? Mr. Trump's continued involvement in his private businesses makes him vulnerable to violations of the Constitution's Emolument Clause. In the most recent example, Mr. Trump's business received a gift from China last week in the form of a 10-year trademark on his name. After years of battling to take back the rights to his name, Mr. Trump's registration was made official on Tuesday and announced by China's trademark office on Wednesday. The Chinese government took this action 1 month after Mr. Trump took the oath of office and a week after his conversation with Chinese President Xi Jinping, during which he endorsed the One China policy. Have you registered a protest or called for an investigation into this and other possible violations by Mr. Trump of the Emoluments Clause? Will you do so in the future?
Under your replacement plan, what will happen to the medical loss ratio currently required for insurance companies? And do you think this will increase or decrease premiums?
Has anybody ever protested outside your office before? Do you think the protesters are paid? What about the ones outside your office? Do you think they're paid too?
My name is Chris Fisher and I live in White Salmon. I'm a self-employed jeweler with a line of jewelry that I both wholesaled and retailed nationwide. And as a self-employed person, I've always grappled with the high costs of insurance and medical care. It's only been since the ACA that I've been able to receive comprehensive health care. Previously, my deductible was $20,000 and everything else had to be paid for out of pocket. This was not sustainable as it limited my access to proper care. Congresswoman, nobody wants to go back to unfettered market control of medical care where companies have the unfair advantage of holding people's lives in their hands. This enables them to charge far more than fair market value for goods and services and place profits over people. Free markets are simply not the appropriate avenue for delivering health care, and to say that competition in the marketplace will take care of costs is something that's been disproven over time. It was in fact the reason we needed reform in the first place. We're talking about lives, not widgets. Obamacare has helped people and saved lives by working with the complexities within the system to deliver solutions. Yet you insist on repealing it rather than working on it. If you do repeal, almost 3,000 people in Klickitat County alone will immediately become uninsured. My question to you is this: if you refuse to work with Obamacare, what is preventing the Republicans from supporting a single-payer system along with an optional insurance system for those who choose it, similar to England?
Hi, Jamie. There are 75,000 people in your district who have coverage through the Affordable Care Act. Can you commit that any Republican replacement for the Affordable Care Act will allow those people to have coverage? Not access, but coverage. Thank you.